Whether you're a clerk or a waiter, an accountant or a doctor, your health matters.
Hello and welcome to your Health Matters, a program that is aimed to give you information on health and also show you what government is doing to improve the health sector. This week we are in Livingstone, the tourist capital of Zambia, and we will visit Livingstone General Hospital where we will look at palliative care. What is palliative care? Let us hear from the public what they think palliative care is.
Do you know what palliative care is?
What?
What do you think palliative care is?
I have no idea what that is.
Palliative care is just a special kind of care which is given to people with tender illnesses.
It's the care given to people who have been sick for a long period of time. Yes.
According to the World Health Organization, palliative care is an approach that aims at improving the quality of life of people who have life-limiting conditions. When we're talking about life-limiting conditions, we're looking at what we may simply call incurable illnesses. We know that the patients that we receive from various centers who come to the hospital have different types of illnesses. Some of the illnesses are curable. You can give them medicine, they are treated, and then they get cured. But for others, because of the nature of their illness, they cannot be cured. So palliative care is concerned with such patients. How do we handle them? Do we just ignore them because we know that their illness will not be cured? So that is what palliative care is all about. Its aim is to ensure that the quality of life of these patients is improved. According to the knowledge, the science of medicine, this illness does not have a cure. But we don't know how long. You may live longer than those who have curable illnesses. We don't know how long. But because you have an illness that cannot be cured, you become a palliative care patient. The patients that are eligible for palliative care are those who have illnesses that cannot be cured. For example, patients who have HIV. We receive a lot of patients who have advanced HIV. We have patients who have advanced cancer. We have also patients, for example, the epileptic. So all these categories, as long as a patient has an illness that cannot be cured, they qualify to be patients who need palliative care. The main aims of palliative care is pain relief. And when we talk about pain relief, we are not limiting ourselves to physical pain. Of course, someone might have a headache, that is a physical pain. But beyond physical pain, there are some other types of pain as well. For example, a patient might have no money, no food. That is pain on its own. Others do not have people to talk to. So when you go there as a palliative care team and you begin talking to them, you find that they start pouring out their heart to you. Then you realize that this person actually had pain inside. There was a psychological pain because he felt detached from others. There is social pain mixed with psychological pain. And when you begin talking to them, you realize that these people have a lot to say. Then the other benefit apart from this is that some patients find a family. There are some patients who don't have relatives, who are abandoned. But because of the palliative care team, because of being visited by the palliative care team, they find a family. Even those who are outside the hospital, there are caregivers in the community who go to visit them.
We see many types of patients every day in our lives. If there is any case which needs immediate attention, we report to the center, that is St. Francis, and thus the care will be taken and everything will be done for the patient. And then where we can't manage, because we are nurses, we can't diagnose, and we are limited to prescribe the medicines, and then we refer just there and then. As we move out, seeing the patients in the community, we move with the car just there and then I or the caregiver will take the patient to the health center, and the health center, if there is need of admitting the patient in the hospital, they will refer also. And then, if they feel this patient can only be nursed at home, the patient will be referred back to St. Francis for continuity of care and treatment.
At times, there are some patients who need nutritional support. In our team, we have a nutritionist. So we contact the nutritionist and find out how she can help in that area. So at times, they have some food which they are able to assist those patients with. In cases where a patient is supposed to be discharged, and as a social worker, I assess this person and I see that this person has financial difficulties at home. I look at the social history, the economic activities that this person is engaged in. For such, we write letters of recommendation to the Department of Social Welfare. We refer them to the District Social Welfare Office for assistance. As a hospital, we provide palliative care within the hospital and also outside the hospital. When the hospital has done its work, concluded its work, and feels this patient must be discharged, we discharge them through the hospice. Some of the patients go to the hospice. The doctors would look at the situation and see that this patient needs further care. Then there's another category of patients who are discharged through home-based care. Because for us to refer a patient to the hospice, we don't force, we explain. When the doctor has seen that this patient is supposed to be taken to the hospice, they notify the palliative care team. We counsel the patient, we also counsel the family.
The health of my mom, especially to my part, it affected me. The time I completed school, it's the time she got sick. It was in 2010, I completed school. I was supposed to go further in my education, but there was no one to live her with. So I'm the one who's been nursing her since 2010 till to date. It has really affected everyone, especially that she was the breadwinner. We help her a lot, that she can't walk, she can't do anything. Everything, we do it for her. Like bathing her, yes, I bath her. I lift her from one place to another. I can say I have less time for myself. Sometimes there are times that we don't have money to buy her medicine. The St. Francis people usually come here. They would come and bring medicine for her. It really helps a lot. They also gave her a walker so that she'll be trying there. She tries to walk from.
The word of advice, or the word that I can speak to them, is that people who have life-limiting illnesses, people who have chronic illnesses or incurable illnesses, are still human beings. They matter because they are human beings. And as much as possible, we must do all we can to ensure that their quality of life improves until they die.
Even when faced with life-limiting conditions, patients that are terminally ill also need specialized treatment. This has been Tasila Tembo Peters. Stay healthy.
It matters, your health matters, yes, it matters, oh. Whether you're a student or a mother, a lawyer,